Introducing Dr. Rajni Katipamla, a well-known oncologist today of the Twin Cities, to come over onto the stage. And Rajni Garu actually is, she's a doctor at Minnesota Oncology, and she grew up in Visakhapatnam, India, and she has completed her medicine in Vizag, Andhra University. And after that, she was here in US since 1999. She did her medical in Massachusetts, and after that, she later on moved on to pursue her fellowship in oncology at Mayo Clinic, Rochester. And then she received her ASCO Merit Award in 2008 for her groundbreaking research and influence in MRI in mastectomy of breast cancer patients. She has authored several papers through her fellowship and during her fellowship and after that. And her goal is to take care of all her patients using the cutting edge technology and also focus on the quality and the well-being of her patients. For the last few years, she has been practicing and she is very busy with all her patients, and still she takes time to actually give secondary advisors, second options, and interpret medical reports of through phones and emails back to the patients in India and help us make a conscious decision. So I take today pleasure in introducing Rajni Garu.
I would like to thank IM for giving me this opportunity to talk today. Can you hear me?
Yeah.
Okay. Before I came this evening, I actually made up like 37 slides and I said, okay, I'm going to give so much information to all of you about cancer. But after hearing Krish and Sunoj talk, who are the second generation Indians, and I'm the first generation Indian still trying to make success and trying to do whatever I can to help both people here and people back home, and that's a struggle that I think we all first generation Indians go through. I think Raman introduced me, saying I came from Visakhapatnam. So let me just give you a quick introduction. Being a first generation, how I came up and came to Minnesota. I grew up in Visakhapatnam. I lost my dad when I was 10, and my mom, who was sitting right there, was able to bring both me and my sister, who was also sitting there. I think it was a struggle. When you said, Krish, about vulnerability, I think definitely that, we went through that phase, whether it's here or whether it's in, back home, I think. Since when I was 10 and said, my dad passed away in an accident, I said, no, they didn't have medical services there, so I said, I want to be a doctor. And my mom said, do you know what that means? I said, well, I want to be a doctor. And she said, well, if you want to be a doctor, you have to be dedicated. You can't complain about these many years of studying, which, I hear every time. My daughters, I have 3 daughters, and say, Mommy, do I have to do all that homework? Well, so she said, you have to be dedicated. And I said, I am. I want to be a doctor. So I think that kind of made me, and my desire to become a doctor. I did my medical school back home, and then like any other, at least more than half of people here married a software engineer who's also here. And came to this country and did my residency in Massachusetts, and then did my fellowship in hematology oncology at Mayo. And it's really during my residency when I'm taking care of this cancer patients that, I developed this really a sense of, wow, I mean, these patients are a totally different group of patients that we have to take care of, and the passion of, I think this is just a different group of patients. And that passion led me to come to Mayo Clinic and my fellowship. And for the last 5 years, I've been practicing with Minnesota Oncology. And as Raman was saying, I do offer advice. And I think the biggest cultural gap from first generation to second generation, or even from Indian to American, is that I think, and probably all, I don't know how many physicians are there in this room, but back home, we don't ask questions. We do not ask questions to the physician. They tell you something, you do it. And here, it's patient is the most important. I mean, we try to educate the patient as best as we can and help them make the decision that they could take. And I think that has been the most significant change when I came to do medical. When I did medical school back home, I did my residency records. I say, this is what it is. This is how it should be done. You ask your physician. And if they can't ask, I make that phone call to those physicians and say, this is what you need to do. Can you please help them? And I've made some contacts back home that way, and I was able to, help a few patients get care. Again, we're all busy, and as a busy mom of 3 kids under 10, always struggling to do that. But since I put in effort, sitting at 2 o'clock, trying to make at night, trying to put some slides together, I'll try to get you through a few of the slides, and maybe have you learn a little more about cancer. And if you get bored, you can just say, can you please stop? And then you can ask me any questions after that. So I just wanted to kind of talk about, what is the incidence of cancer rates in India and United States? What is cancer? How do we diagnose it? Treatment, cures. And again, I don't want to bore you with all of this, but I'll try to get through the slides as quickly as I can. But feel free to stop me if you get bored, because I know that this is not something that you came here to learn about cancer. It's more to connect with people. And but being the physician I am, and being the passion I have for oncology, I think I had to make a few slides at least. So it is the 4th leading cause of cancer in India after heart disease, respiratory disease, and tuberculosis. Whereas in the United States, it's the 2nd leading cancer after heart disease. So, but in spite of that, I mean, if you look at the graphs from the CDC, the incidence of cancer in American Indians, which fall in that blue line right there, in which group we fall into, is still at the bottom. And the same thing for the death rate. So what does that mean? I think the risk of developing cancer in Indians of American origin is still very, very low compared to our counter population. The reasons could be anything. It could be a different genetic pool. It could be risk factors such as smoking. I think with all the aunties and uncles telling you, hello, don't do that, don't do this. Maybe we have more support in trying not to do that. And then the diet choices that we have, which are definitely different from what the American foods here are. So what is cancer? And when people hear about cancer, there's so many things that are going in their brain. What is cancer? Why did I get it? What could be the cause? And a lot of things kind of go through your brain, and definitely not the zodiac sign. I think if you ask an 18-year-old or a 15-year-old, they might come up with that, but it actually just means that it's a loss of normal growth or loss of control, in simple words. But cancer, all cancer is not malignant. You can see that, on your right, your left maybe, where you can see that the cells are more uniform and it's benign, whereas the other side is more malignant. And cancer cells do spread, they go to different places, and that's what makes it bad, and causes death. So, in brief, cancer can start any organ, it can go to any place if it's malignant. There are 4 stages, and depending on which stage it can go to, your treatments differ. So most cancers are generally from acquired mutations, only 15% are hereditary, and some of the clues for hereditary cancer are early age, multiple family members, and no risk factors. So the biggest risk factors, again, smoking, I can't stress that enough, causes 30% of all types of cancers and about 87% of all cancer deaths. I think this is probably where I should stop, right? The risk factors, body weight, diet, physical activity. I think every one of us try to fight with these things every day in our lives. There's a lot of data saying, these things can be associated with cancer. So it's really weak immune system, exposure to toxins, and poor lifestyle habits that can lead to cancer. Can we pinpoint? No, we can't. But it's just generally taking care of yourself and trying to do what's right, eating right. I'm going to skip through some of these things. The treatments of cancer have really evolved over the time. They have moved from surgery, radiation, chemo to being more targeted. There's so many targets that they've identified now that it's just mind-blowing about the field that's going on in cancer research. So from generalized where you get Tylenol for all headaches to being more personalizing, you get Tylenol, you get Motrin, things are definitely changing in that way. So I just wanted to say this is an IAM event, this is Indian event, and what does India bring to the treatment of cancer? What is it that's so special to the Indian diet that may have reflected in our cancer rates? And I don't know how many of you remember, but there was a grant that was, or a patent that was issued to 2 Indians from University of Mississippi for turmeric. India had to go through a lot of lengths to kind of, repeal that, or I would say revoke that patent and wins that battle. So the biggest or the most influential things that are available to us with highest anti-cancer properties and that are even listed on the American Cancer Society are turmeric, garlic, and goji-kola, which is a small plant found in certain regions. So I think we are recognizing that. We are moving to use those traditional medicines in our everyday life, and I think all of these things have some medicinal properties, so really I think we do a good job of trying to add these in our diet and probably helping decrease. It's a very well-balanced diet. I mean, it has the right mix of everything that we need. Only if we can try and keep up with that, but we can't do it every day. So you may be at risk of throat cancer if you have a throat. It's sort of like, and if you don't have lungs, you can't get lung cancer. So, so I would like to end there, and those are my 3 years daughters that.
Pause for Dr. And now I would like to invite Ms. Shanti Shah on stage to recognize and thank the good doctor.